Clenching your teeth or grinding them in your sleep could be a sign of bruxism. I know I'm guilty of that. What is it and who can help? Let's find out from an oral surgeon.
As an oral surgeon, we take care of the surgery in the teeth, anything from extracting teeth that need to be removed for infection or fracture. Some of the people that grind their teeth, they can end up fracturing their teeth. Restoring the missing teeth with like implants, bone grafting, treating and detecting oral cancer, treating it, trauma to the jaws, jaw deformity corrections and such.
Okay, so that teeth grinding is also known as bruxism, often happens at night during sleep. And bruxism may be related to stress and anxiety, sleep disorders, and an abnormal bite of the joints, also known as TMJ. So let's take a look.
Ever notice that when you wake up in the morning, your jaw hurts? That may be because you grind your teeth at night. Teeth grinding, also known as bruxism, often happens during sleep. Bruxism may be related to stress and anxiety, sleep disorders, an abnormal bite, or temporomandibular joint disorders. Symptoms can include a dull headache or sore jaw. Your teeth may become painful, cracked, or even loose from grinding. Your dentist can fit you with a mouth protector to help guard teeth during sleep. If grinding your teeth or clenching your jaw is caused from stress, find ways to reduce tension. Try practicing relaxation techniques, exercising, or yoga. If you have any questions regarding bruxism, ask your dentist.
Okay, so this video gave a really great explanation, but if you can sort of elaborate on what bruxism is and how common it is.
It is actually common. It's one of the ways people relieve stress sometimes. Some people get a heart attack, some people get a heartburn, some people tend to clench their teeth to relieve anxiety. Basically, it has to do with the clenching of the muscle, constant clenching or grinding of the muscles of mastication, which you used to chew, and some of them are quite powerful. So they're supposed to mush the food that you're going to eat before you swallow it. But also when you don't have food in your mouth, you can be clenching and just overstressing your teeth.
Now, there are different types of bruxism.
Correct.
So
awake and asleep.
Awake and asleep, okay.
Yeah, so you can do it while you're awake, in which case you would be able to detect it and stop doing it. And sometimes it happens at night when you're not even aware of it. Some people don't even know that they do it.
I wasn't aware that I was doing it too, but one thing that I do notice that I do sometimes is I tighten my jaw. Is that a form of bruxism?
It is.
It is.
Yeah.
Okay.
You tend to wake up with a tired jaw. Some people even think that they have problems with their wisdom teeth, and it's actually excessive pressures in the jaws, not so much the wisdom teeth.
That's
so you have to
interesting.
see a professional to determine which is the cause of your discomfort. Yeah, so it's very common for it to happen at nighttime.
So how does it manifest itself?
You can see wear and tear in your teeth or in your restorations. Sometimes your crowns start chipping and your jaws feel tired. You can have headaches as well.
Right.
So all those things are signs and symptoms of bruxism.
Okay, since we're talking about teeth and it might be related to bruxism, you know, when you chew ice as well, is that also a form of
Well, it's not a good habit.
It's not a good habit,
have,
no.
obviously. But yeah, I mean, some people tend to like chew on things. Also, another thing that makes it worse is chewing gum. So if you already have grinding to begin with, chewing gum is going to only make it worse. You're overexerting your muscles of mastication.
That's so interesting.
Yeah, sometimes they become acutely inflamed, and the muscle inflames, and the sheet that covers it stretches, and it's very painful, at which point you would treat the acute phase. And then for the chronic treatment of this, there's other modalities that we're going to discuss today.
And before we discuss, I think it's important to get into the symptoms of bruxism. So there are quite a few. So if we can go over these, Dr. Lozano.
Yes, so there's grinding and clenching of the teeth, in which your teeth are tight and you may move them from side to side. Flattened structures of the teeth, like your teeth wear and they become very flat. Sometimes you even lose the vertical dimension, like this portion of your jaw becomes shorter because the wear of the teeth.
It's shortening.
Yeah, so you would need to increase it again by restoring the vertical height of your lower jaw. Increased pain and sensitivity. Sometimes you lose all the enamel of the tooth because it's worn, and your dentin and your pulp of the tooth are exposed, and then you may even need root canals and at that point. Tired jaw muscles.
The locked jaw. The locked jaw is often, is that the
It's
TMJ?
inability.
Yes.
Well, it happens with TMJ with the problem in the joint itself.
Right.
But it's worsened by this extra clenching. It puts a lot of pressure on the TMJ as well. You can even get earaches from this. But sometimes if you clench too tight at night, you cannot even open your mouth well in the morning. So you have to go through a period of relaxation to be able to open your jaws again. And sleep disruptions, so that's also has to do with the sleep bruxism.
Yes.
Some people that have sleep disorders, such as sleep apnea, can develop bruxism on these phases of awakening that they go through at night trying to breathe. And it's also seen in those patients, so that will require a referral to a specialist in sleep disorders.
And as we saw in the video, there's also headaches.
Correct.
You can get ear pain from. Really? Okay.
It's because the joint, which is right here, is next to the ear canal. So sometimes you feel the pain right here, but if you open and close, it's right there. So it all is in the same neighborhood.
Yes.
So it all shows in the.
So the whole neighborhood gets affected.
Yeah, you think it's an earache, and it's in reality it's a TMJ problem.
Amazing how many symptoms there are, including ear pain. I didn't expect that symptom. And if you want to watch more of the interview, I suggest you download the Health Channel app for more. Remember, if you have a question, you can email us by visiting our website, allhealthtv.com, or give us a ring, 855-796-4475.